Hello, everyone. I'm Dr. Debulina Mukherjee, and welcome to the third episode of Epilepsy Voices of India by the Indian Epilepsy Association. We all know that epilepsy is a common neurological disorder. However, despite all the recent advancements, we continue to face looming treatment gaps. One of the possible reasons behind this is the many myths, misconceptions, and misunderstandings pertaining to epilepsy. So, in this episode, let's try and debunk as many myths and clear as many misconceptions as possible. And to do this, we have the honor of having with us the very renowned Professor Bindu Menon, ma'am. She is a senior consultant neurologist and head of neurology at Apollo Hospitals, Nellore. She is the Secretary General of the Indian Epilepsy Association and board member and co-chair of the Research Committee of the World Stroke Organization and ICMR adjunct faculty at NIE Chennai. As founder of the Dr. Bindu Menon Foundation, she leads the Neurology on Wheels initiative, which has many innovative apps and continues to promote awareness, early diagnosis, and accessible neurological healthcare. She has many prestigious national and international awards, and she believes in combining excellence in clinical practice with academic leadership, global recognition, and community impact. Thank you so much, ma'am, for joining us today.
Thank you so much, Debulina. This initiative by the Indian Epilepsy Association, carried forward by you, Debulina, reminds us that epilepsy is treatable and people with epilepsy deserve understanding, not stigma.
Thank you, ma'am. So let's start busting some very common myths now. First, let's talk about some common myths and misconceptions regarding epilepsy, its cause, and its nature. So, one very common myth that we often have to deal with is that it is a supernatural phenomena or a paranormal activity. It is caused because of some spirits or possessions and curses. So, ma'am, what is your opinion on that?
Yes, Debulina, this is one of the most common and deeply rooted myths. Epilepsy is purely a medical condition of the brain. Our brain works through electrical signals, and in epilepsy, there is an abnormal electrical activity that leads to seizures. It has nothing to do with black magic, for possession, sins, or most of the time, some people say that past life, purane janam ka karma hai. No, it has nothing to do at all. It's a medical condition. Understanding this is very important because such beliefs delay the proper treatment.
Another very common myth that people actually fear a lot is that it is contagious, that they will also acquire it from the person.
Yes, Debulina, this is another stigma, and people with epilepsy are probably sort of shunned because of that. Epilepsy is not contagious at all. You cannot catch epilepsy by someone who is sitting next to you, eating with from the same plate, probably hugging or studying together as well in the classrooms, or having a job together, sitting in the same cabin. So this is not a communicable disease because whatever we have spoken just now, the type of diseases that spread, that happens in that way, this fear is unnecessary. And because of this fear, it causes social isolation. And probably I feel, and most of our neurologists, we feel that that's probably more harmful than the illness itself.
Right, ma'am. And we also have this misconception that we think that epilepsy and seizures occur only in children, and we find it difficult to believe a new onset epilepsy in adults.
Not at all. Debulina, epilepsy can occur at any age. We all know that. While it might be a little common in childhood because of certain reasons that happen at that period of time, many adults also develop epilepsy later in life. Especially in adults, we know that a stroke, a brain stroke can cause it, head injury can cause it, any infections of the brain or a brain tumor can cause it. So the disease-specific reasons is different in across the spectrum of age, from newborn to the child, to the adolescent, then to the adult and the very elderly. So epilepsy is not a childhood-only disease.
True, ma'am. Let's talk about this. Another common misconception that people only think that seizures are always associated with very dramatic convulsions and loss of consciousness, but there are also so many other seizure types that we must know.
Yeah, yeah, absolutely. This is something many people don't realize, that there are many different types of seizures. The one which people usually associate and understand is the one which are usually also shown on the movies. So that's how people get to know them. They are the grand mal seizures, which used to be called earlier. They are the generalized seizures where the person falls down, has jerky movements. He might pass urine, he froths from the mouth, and for a couple of minutes he's unconscious, and then he starts gaining conscious gradually. That is one type of seizure which all of us know. But we are looking at different type of seizures. Why it is also very important? Because everybody should understand that a person with a generalized seizures may also have these type of seizures, and if they do not identify these seizures and do not tell the doctor, they might be subjected to some medications which might not take care of all the seizures. So there are type of seizures called absence seizures. Absence seizures are very common in children, where the child just stares for a couple of seconds, and they happen multiple times in a day. They do not fall, they do not jerk, they do not froth, they just sit in that particular position. There's another called a complex partial seizure, where the patient looks confused. The patient can have weak, say it is automatism, or continuous movements. They may be fidgeting with the hands. They may have this lip smacking. They look confused. They may move around. They may continue to do what they are doing, but they are unconnected. They are not connected with the surrounding. If we talk to them, they do not reply back. They may look as if they are awake, but they are not connected to the surrounding. The other one is where patients with generalized seizures, as we told, they may have early morning just a jerk like that. All of us know that while we move on to sleep, we get these jerks, which are called the hypnic jerks. They are not seizures. But then, if the big seizures, which we call, are also accompanied by these jerks in the morning or at some point of time, need to identify these type of seizures and tell the doctor, because all the seizures are just one form. Many seizures are very subtle and often go unrecognized. So identifying them, the generalized seizure, the absent seizure, the complex partial seizure, the myoclonic jerks, and also telling the relatives to take videographs if they are able to. The priority is the patient always, but then if there are a couple of people around, you can always take a videograph. If any of these activities are looking similar every time, then it is imperative that they tell the doctor. It could be one form of seizure which is developing in the patient.
Right. So I hope this helps people understand these other seizure types, and more aware they are, the easier it will be for them to identify. So let's now talk about some very common myths and practices during first aid during seizure. So very common technique practice is to put metal keys in their hands to stop the seizures.
Yes, I see it so commonly now. I have been doing these awareness programs for the last 2 decades, Debalina. But still, when I go for the schools, colleges, and social organizations, and I just put them a questionnaire to them, and also while I'm talking to them, and ask them for raise hands, that if person has a seizure at this place while we are standing, what is the first thing that you will do? So 75% and above will say that they will rush and put a key in the hand. So that's this been there for very long. So one needs to understand that there is an electrical activity in the brain that has happened, and that's an abnormal electrical activity because of which the patient is having a seizure. So an abnormal electrical activity in the brain can just not be stopped by keeping a key in the hand. So that was probably at some point of time where we didn't have medications, because we know that it is a very old disease. So people did not have anything to do. So probably because of the jerk, they feel that it's some sort of electrical injury that is happening. So probably they kept some keys iron. Basically, it's a metal. They want to keep some metal in the hand, so that. So what happens is these seizures last only for a minute, or probably 1.5, 2 minutes. By the time they get the key and keep the key in the hand, the seizure does settle down. So usually they feel that the keys are the reason that this fits have settled down, but it is not so. It would have settled down irrespective of whether we have kept any metallic object in the hand. So keys do not shorten, neither stop a seizure.
Right, ma'am. And they also make them smell shoes and chappals to terminate the seizures. So that's another practice.
Absolutely. They keep onions, they keep the motto behind that shoe, and all of this is that any of that bad smell is going to sort of irritate the person, and then the person is going to get up. But no, strong smells do not stop seizures. Instead, actually, they may increase the discomfort or panic in people around by doing all of those things.
And another very common belief that they have is that they'll swallow their tongue and they'll choke on their tongue. So something needs to be put inside their mouth.
Yes, Stablin, actually, when a person has a seizure, it's really something which is a little terrifying for people who have witnessed it for the first time. So they are very worried, and this is an very dangerous myth which we usually see. A person cannot swallow their tongue. So putting spoons, putting fingers, a cloth in the mouth, they can just cause more injury. Sometimes there is a jaw injury. They can break the teeth. More importantly, they might produce choking to the person. And that can be a dangerous situation. We know that they can become a life threatening. The seizure, which would have stopped within a minute or so, and patient would have gradually come back to consciousness, this would probably engage the patient into the hospital and in the emergency and in the ICU for a longer period of time, and that increases the problems. The safest rule is actually very simple: do not put anything in the mouth.
And I think out of fear also, and out of this necessity to do something, they also start pouring water down their on their heads and down their throats also. So that's another very dangerous thing.
Absolutely, because it's common practice that if somebody falls down, somebody rushes with a handful of water and throws it on the patient's face. So, Deblina, we need to understand in patients with syncope, that is suddenly if the patient's blood pressure falls down, or patient has a fright and has falls down, or some other reason the person falls down, that's just lasts for a couple of seconds. So usually, for an alerting phenomenon, patients they throw a handful of water onto the face. But this does not stop seizures, and this can be harmful again. So, depending upon how much water you're pouring, as you said, they might pour from a glass. So, water may enter the airway, and that can cause breathing problems. Again, the seizures will stop naturally, and our role is only to keep the person safe during that period of time.
And their tendency to restrain them as soon as the convulsions start.
Yeah. So again, we need to understand that the electrical activity in the brain is so strong during a seizure that it can even light an electrical bulb. So that much amount of electrical activity, if it is happening, and if the person is jerking, and if somebody is trying to restrain, that can only produce more harm because it can produce fractures. At the same point of time, this is not a cardiac arrest that the patient is happening. What we are trying to imply to you is that the heart is still beating. In fact, the heart is beating more. The patient can have a high pulse rate, the tachycardia, and all of those things. He's sweating, all of those things can happen. So, you are not supposed to do a cardiopulmonary resuscitation, we call it as CPR, which is done in an absolutely different scenario where the person falls, becomes unconscious, is unable to breathe, and the patient does not have a pulse. So you are putting compressions on the chest to see that the heart starts getting activated. So in a seizure, there is an electrical activity. The person has fallen down, the person is jerking, the heart is active, and it is more normal. In fact, it is acting more. So once the seizure ends, the breathing also usually starts getting coming to normal, unless you have poured water, or the person aspirates, or you put a handkerchief, you put a spoon or something of the sort in the mouth, which is going to aggravate and create more problems. So the correct first aid in such a condition is to turn the patient to the side, the left side, after the seizure has stopped, and remove any sharp objects which could be nearby, and to wait calmly and then take a decision once he has come back to his normal senses.
Right. So these are very essential do's and don'ts during seizures, and I think following them will ensure that we do not cause more harm than benefit to the person. So now let's talk about some common myths which are regarding the people who are living with epilepsy. So a very common misconception is that people with epilepsy, especially children, cannot be sent to school.
Yes, and it is often said that once a child has a seizure, the seizure or the epilepsy does not have a bearing on the education, but because of the fear that the parents have, and I completely understand actually, Debalina, actually any parent would be a little worried because the child, if the child has a seizure in the school, the child has a seizure while he's traveling in the bus, getting down the bus in the staircase, I can understand that. But we need to tell them that, and we ensure them that if the child has been diagnosed with epilepsy and he has been kept on medications, and if he takes the medications properly, then there is no need to worry. They can absolutely can, and in fact, they should be sent to school. Most children with epilepsy have absolutely normal intelligence and learning abilities. We have our patients who have been in a high peak of career. We have seen them as children, and now we see them. We have their photographs printed in the newspaper when they come in, when they stand first in the school, then in their colleges, and then it gives us so much of pride, and they set an example to other people and to other persons with epilepsy as well. So with proper treatment and with support of teachers, they can do extremely well academically as well, and education is a must, empowerment is a must. They should complete the education to the best of their abilities that they have.
Absolutely, ma'am. And we all also a lot of people have this thought that all people with epilepsy and seizures they have intellectual disability, but that's not true.
Absolutely. So it's been commonly connected that if the person has a epilepsy, then probably there is an ID intellectual disability as well. No, the majority of people with epilepsy have normal intelligence. We are talking about a small subset of children who during delivery they have a hypoxic brain damage and their brain do not function, and they in turn develop seizures. We are talking about epilepsy as a condition in which only seizures are the condition in that particular individual. So epilepsy itself does not mean poor brain function. Once a person has been diagnosed with epilepsy, it is imperative that they also take care of the brain health. They take the medications regularly, they exercise properly, they eat good food, they interact, they have a good social surrounding. The social determinants of health, we say, they do not keep brooding, they do not keep discussing about it. They come to the doctor, clear up their doubts, and then that's it. Then they take the medications, regular follow up. If any issues regarding their condition does happen, they need to immediately consult their treating neurologist or their treating doctor and clarify it, rather than going out and talking to somebody. And again, all these myths will be again, they will sort of surface out. Somebody may say something and they may again get demotivated, whatever the condition and situation they might be in. So most children with epilepsy have normal intelligence. As we said, we all of us have seen our patients coming out of medications after a period of years and doing extremely well, not only in their profession, in their family life, social life, and everywhere.
Yes, ma'am. And similar to school, there's also this misconception that people with epilepsy are not fit for employment.
Yes, we do see it very often, and that most people, sometimes their superiors, when they get to know that this person has got a seizure or an epilepsy condition, that they remove them. In fact, it happened. So most people with epilepsy can work productively and responsibly. In fact, many of them are doctors, many of them are teachers, engineers, artists, professionals in every field. So one need not worry. One need to little bit take care about certain professions should not be taken. Like once any of those which is involving working at heights, driving as a professional driver. aircraft, that any of those conditions, with open machinery as well, because as rightly said, a seizure will not happen, but in certain condition, if it does happen during that particular time, there are so many other professions that are open out for them. So why we need to choose those with heights, open machinery, water, and driving? So that might be something which we might want to ward off. Otherwise, every area is open for them, and employment to all those people who are supervisors and who are at positions who are employing. Employment should be based on ability, not on fear or stigma.
Yes, ma'am. And I think one of the very worrisome misconception is that people with epilepsy, especially women, cannot marry and have children.
Oh, yes. I all of us see this day in and out. In fact, women with epilepsy cannot marry, and we also see the other way around, that boys with epilepsy can marry because marriage is going to cure them of the epilepsy. So if it is for the male gender, then it should have been for the female gender as well. But then either one is not right. It doesn't cure the epilepsy, and if you have epilepsy, you shouldn't marry. Only you should have a shared decision making with your spouse and partner and their family members, because even if you're having epilepsy and you are on medications, you need to tell your treating neurologist way ahead, because an seizure free interval, that is a fit free interval of around 9 months, should be there if you're planning for pregnancy. If you're planning for marriage itself, it is very important that you discuss with your doctor, because there are certain medications which are not advisable during pregnancy. It is advisable for the women with epilepsy, but they're not advisable for pregnancy because they are not good for the growing fetus. So you need to give time to the doctor. You need to give time to the condition to switch from one medication to the other. So if there is a proper planning and there is a proper medical advice, then pregnancy is usually very safe for women with epilepsy. All of us neurologists, we know that we have so many women with epilepsy under us who have had extremely uneventful deliveries, and they come with their beautiful children to us to continue with the treatment for epilepsy. The
Absolutely, ma'am.
mother, the mother
Yes,
comes, not the children. The mother comes.
absolutely, ma'am.
Yes.
Ma'am, let's talk a little bit more about the myths regarding epilepsy treatment. So, despite all the progress that we've had so far, many people still believe that epilepsy is not treatable.
Yes, in fact, actually, one should keep it this way. Is one of the most treatable neurological disorders. You see, if we feel that, let us take other neurological disorders, dementia, Debalina, we know that Alzheimer disease, we really do not have a medication under the roof. If we look at myasthenia gravis, or we look at multiple sclerosis, if we look at strokes, for that example, all of the diseases in their own standing have got their own problems. But then in epilepsy, if the person takes medications properly, his compliance is good. He has a healthy lifestyle, and he sleeps well, and he takes care that he doesn't have any other offending antibiotics, and he always ensures that he tells the other doctor, if he goes for any treatment, that he has got epilepsy. Then in most of the cases, we do not see that the person continues to get seizures. He has got a very happy follow-up with us. He comes, or she comes with us for every 6 months. And we know that almost 75% of the patients can get seizure-free with the right medications after a particular period of years, depending upon their type of epilepsy.
Absolutely, ma'am. So compliance is very, very important to ensure a healthy living. So I'll end with this question, and a doubt of many people is that does epilepsy always mean lifelong treatment?
Oh, those not always. I would say that there are a set of patients who might need lifelong treatment, but then usually this set of patients is already known for the doctor and the patient, and there would have been a shared decision and a shared discussion that would have been done, and we would have told them because it would have been attached to some other variables also. But many, almost 75 to 80% of patients, after 3 to 5 years, depending upon their condition and how it was, how many medications are there. After that, we gradually stop medications after they become seizure free for a particular period of time. And this gradually stopping medication is also under medical supervision. Most of the times, it happens that we tell them that now, as we have told in this YouTube, that patients we have after 3 or 5 years. So patients start taking 5 years and then they abruptly stop it off. That is also not done. There might be certain variables which we might be wanting to consider while we gradually stop the medication. So what we need to understand is that treatment is extremely individualized depending upon the type of epilepsy they have, and as we mentioned, the type of seizures that the person has and the underlying condition, if at all they have. It also depends upon how well the person understands the condition. So it is individualized. Many patients do come out of the treatment after a couple of years, absolutely off medications. But this disease is not lifelong by default.
Thank you. Thank you so much, ma'am, for clearing so many of these myths and misconceptions and for giving us your valuable time. I really hope this helps clear a lot of doubts and also reduces stigma and opens and encourages more open conversations about epilepsy in the future. Do you have any final message for our viewers?
Yes. Debelina epilepsy is a medical condition, as we discussed now. It's not a social curse. With proper awareness, as the Indian Epilepsy Association is putting its foot forward and trying to reach each and every household, so that not persons with epilepsy only alone, people in general, the public in general, because awareness needs to spread there. Correct first aid, what you should do, what you should not do, timely treatment, and community support, persons with epilepsy can live confident, independent, and meaningful lives. And that's what the Indian Epilepsy Association is striving for.
Thank you so much, ma'am. And thank you also to our viewers for joining us today. Do stay tuned for more such informative videos. Thank you.
Thank you.